Okay.
Okay, we start. Okay, so everyone, good night. So today we will have our 8th group discussion with a new theme that is about rare disease or sickness. So my name is Nur Hazika Shuhada binti Hamal and my metric number is 203207.
My name is Rafiq bin Abdul Razak and my matric number is 204431.
Okay, my name is Xiaozongqi. My metric number is 191516.
My name is Chen Yihen, and my metric number is 194969.
My name is Nur Nadia Hana binti Rashdan. My metric number is 197811.
My name is Zhu Mingshen. My metric number is 201572.
My name is Wei Chan. My magic number is 200093.
My name is Si Tong, and my magical number is 201421.
My name is Ali Faikal bin Zabani. My matrix number is 200658.
My name is Yang Mingqi. My metric number is 200100.
Okay, so now everyone have introduced ourselves. So today, let's start our discussions. So for this theme, this week's theme it is rare disease or sickness. So for the first story, I will talk about uh, a rare disease called Stoneman syndrome. So the scientific name of this disease is actually fibrodysplasia of significant progressiva, or known as FOP. So since the scientific name is hard to pronounce, so I will call it Stoneman syndrome throughout this discussion. So I will later show you the pictures of the people who suffer from the Stoneman syndrome. So actually, Stoneman syndrome is an ultra-rare genetic disorder, as it's only affect 1% in every 2 million people worldwide. So this syndrome is actually cause bond to form where it should not, such as outside the skeletons and in the soft and connective tissue such as muscles, tendons, and ligaments. To explain this, actually all humans start developing bonds when they are in the fetal stage, and they will actually continue grows until a certain point in their life. And so during this growth, the bonds will grow as cartilage or muscles in the body. So it's actually later will be ossified. So ossified is actually the hardening of muscle tissue until it becomes bonds. So that is how normally our bonds would grow, and it will stop at a certain times in our life. So but for the person with Stoneman syndromes, their bonds do not stop growing, and over the skeletons, such as over the skeletons, there another skeletons grows, and this condition is known as heteropic ossification. So this disease is actually presents from birth and caused by genetic mutations in LK2 or SCUR1 genes that's normally involved in the normal formation of bones. So according to a rare disease website, the persons who suffers from Stoneman syndromes are usually bedridden by age of 20 years old and have life expectancy of 40 years old. So sadly, the people who had this disease must be careful in what they are doing, because small injuries such as a small kick on the leg could lead to growth of more bones. And if they are injured, such as when the muscles, tendons, or ligaments get damaged, the bones growths can occur, and this condition is known as flare-up. So they need to avoid this flare-up throughout their life. So the extreme bones growths actually usually happens first on the upper part of their body, then later it will spread to other parts of their body as they grows, and this will then affect their mobility and sometimes cause them to hard to speak it, or sometimes it is hard for them to breathe, as the rib cage is being extended by bone growths. And sometimes in those cases, the surgeon will usually remove the extra bone, but the bone would grow back at the faster rate. And there was once a Stoneman syndrome sufferer called Harry Islak, where he turned into stones where at the end of his life he could only move his lips. Um, and now actually his skeletons, he is actually known as a humans with two skeletons, as he had two skeletons. So the skeleton is now displayed in the Mater museums in Philadelphia, where actually the scientists use that skeletons to search for a cure to the Stoneman syndrome. So as of 2019, there are only 3 types of drugs or medicines that have entered the clinical trial for the treatment of these syndromes. So now I will show you the pictures of this Stoneman syndrome. So this is actually the picture. This is actually the pictures of Harry Islak's skeleton in Mater Museum. So he actually had a double layer of skeletons on his head. And this is actually the back of someone with Stoneman syndromes, where you can see actually the extra bones uh, grows on their normal bones. So this is how their back is. So that is the end of my first story. So the next story is actually I will talk about a disease called three-man syndrome. This is actually quite similar because it is the extra growth of something on their body. So actually three-man syndrome, or scientifically known as epidermodysplasia verrucosiformis or EV, it is actually extremely rare skin condition that cause bark-like growths that might affect both males and females. And this disease is a very rare disease that occur in about same like the previous disease, that is 1 in every 2 million people worldwide. So as of 2018, there are only about 200 reported cases of this three-man syndrome worldwide. So three-man syndrome is actually an inherited genetic immune disorder that make human extremely susceptible to human papillomavirus HPV infection. So when the infection actually causes skin to grow, such as vi- viral warts and pigmented inflamed patches, and can actually extremely develop bark-like growths. And the bark-like growths of tissue is commonly developed on the hands and feet, earlobes, or face. And this syndrome caused by an autosomal recessive genetic disorder, where it results from mutation at specific location on certain genes, and it is inherited from their parents, both of their parents, from the same kind of genes. And this syndrome is actually a lifelong condition, and until now there is no cure discovered to treat these syndromes. The only things that the sufferer can do, is actually uh, to reduce the risk of getting cancers from these growths of the bark-like things on their skins. And most importantly, three-man syndrome actually did not affect their life expectancy like the previous syndromes, but actually it will only burden the sufferer. So there are once well-known case of three-man syndromes, that is a 28 years old man from Bangladesh, where he had multiple operation in 2016 to remove all of the excess things that grow on his skins, and he actually had to return to get another surgery in 2019. And this disease actually very burdensome for their sufferer, because actually that man, they cannot perform simple tasks and need helps in eating, drinking, and taking shower. So he once said that he want to live life like a normal person, and able to hold his daughter and hug his daughter. So I will show you the pictures now of that man. So this is the pictures. You can see the bark-like growths on their hands, And this is actually Abu Bajandar in Dhaka Medical College Hospital in Bangladesh in 2016. And the second picture, this is another case where the growth is actually growing on their face. So this is Sahana Khatun, 10 years old. So now I think she is already 15 years old that come to hospitals with the growths like this on her face. So that is all the story from me. Thank you.
So next, I will present my story. Firstly, I'll share my screen. Oh, Azika, can you allow participant screen sharing?
Can you share now?
No, it still says disable.
I think I already allowed actually. Okay. I will make you host. Okay, you are host now, so you can share your screen.
Okay. My first story for today is about this one rare disease. If you look at this picture, you will see that it's similar to somebody that is suffering from allergies or rashes. However, the cause of this woman's allergies is a very surprising element, which is she is allergic to water. Uh, Rachel Warwick, she is allergic to water, and her everyday life is a nightmare. Imagine that even taking a shower or a normal bath is as if it's suffering for her, as well as going for swimming or snorkeling. She has said that it's equivalent to pouring bleach all over her own body. Any contact with water whatsoever, even her own sweat, will leave Rachel with a painful, swollen, and itchy rash, which can last for several hours. The reaction makes me feel as if I've run a marathon and I feel really tired afterwards, so I have to go sit down for quite a while, she says. It's horrible, but if I cry, my face will swell up as well. This rare disease is known as achogenic urticaria, uh, which is the condition known as the being allergic to water. So she is one of the many few people that suffer from this disease. And imagine that being, especially being a human, is that our body is made up of 60% water, and the average 70 kilo adult is already made up of around 40 liters of water. So most people would be asking how can you live if your own body is made up of water? Well, for a start, the water inside their body is apparently not a problem, as the reaction is only triggered when the water comes into contact with their skin. And this it occurs regardless of the water temperature, its purity, or even salt content, meaning that even distilled water will still affect a person like this. So right from the beginning, this disease has baffled scientists, especially that it might not even be an allergy, but it might rather be a reaction caused by the immune system within the body. This is something that is similar to how people are allergic to plants or peanuts, as some of us have allergies. And one of the earliest theory that explain how it works is that when the water interacts with the outer layer of skin, which is mostly made up of dead skin cells, the oily substance which keeps the skin moist, uh, the component inside water causes this when it interacts with our skin, it causes the release of toxic compounds, which in turn leads to an immune reaction. And other scientists have also suggested that the water may simply dissolve chemicals in the layer of dead skin, which allows the outside chemicals to penetrate deeper, which is what might cause this immune reaction as well. And whatever the cause, according to Marcus Maurer, a dermatologist from Germany, he said that this illness can transform a person's life. And he has patients that have suffered with this illness for over 40 years, and every day they still wake up with swelling and pain. And one of the bad side effects as well is that the sufferers usually suffer from depression or anxiety, as they are always worried when the next attack will occur. And then for Rachel, she started experiencing this disease when she was 12 years old, after noticing that she had a rash after going swimming. And she said that when my doctor heard what I had, he said that I might probably have this disease, which is echogenic urticaria. And luckily, the doctor didn't ask her to. He didn't do a test on her because they said that the standard method to diagnose this disease is to keep the upper body wet for half an hour, which is already a painful treatment for a person that suffers from this disease. And for now, everyday activities such as washing up, Rachel's husband, who is also her full-time carer, will have to step in and to help her wash up. And Rachel limits herself to showering only once a week, and she always wears light clothing and avoids exercise so that she does not sweat. And she drinks a lot of milk since the reaction with milk is not as bad as water. However, scientists still don't know why this occurs. And for now, the only treatment that she takes is by taking powerful antihistamines. So that is my first story of being allergic to water. And my next one is about this syndrome called foreign accent syndrome. So when you think about foreign accent syndrome, you might think, what is this? Well, foreign accent syndrome happens when a person suddenly starts to speak with a different accent of their own country or of their own language. And this is commonly occurs to people who have suffered from head injuries, strokes, or any other type of brain damage. Although this disease is extremely rare, it's a real condition, and about 100 people have been diagnosed with this condition since its first known case occurred in 1907. For some examples of foreign accent syndrome, includes a Australian woman who developed a French-sounding accent after a car accident, and also in 2018, an American woman in Arizona woke up one day with a mixture of Australian, British, and Irish accents after falling asleep the night before with a headache. This syndrome does not just affect English speakers because it's also happened to anyone, and there are also cases documented of people in other languages developing different accents. So if we look at the causes of it, we recognize how the symptoms, we might be able to overcome this problem. For starters, this disease is known to have occurred, especially when people suffer from brain damage. So there are different types of brain damage, and one of it is conditions is stroke, traumatic brain injuries, brain lesions or aneurysms, and as well as multiple sclerosis. For now, treatment for foreign accent syndrome, it depends on the underlying case, meaning that if you suffered from stroke or traumatic brain injury, for example, they would have to treat that disease firstly. Some of the other treatments include speech therapy, counseling, as well as behavioral therapy. To end this story, FAS is a legitimate neurological condition, and although it might not seem much of effect as other diseases, but it still causes mental health issues, which, if untreated, can lead to further anxiety or depression. So that is the end of my story. So how about you guys? What do you think?
Well, those pictures certainly are something. I have not heard about the Superman syndrome and who those pictures. It's a bit crazy to me just to think about how do these people live their life when they have such unusual diseases, right? Like Wow, it must be rough for them.
Yeah, I do agree with Alif. I mean, like, can you imagine if someone that have like the growth of the bone on a bone, and how can they live with that kind of condition? Like, it's gonna be hard for them to do work with that bone. And then I do like Rafiq's second story, which is the foreign accent syndrome, right? I mean, although it is a syndrome that caused from the brain damage, but don't you think it's kind of cool if like someday you when you talk, suddenly you have that French accent, Italian accent, or what? I mean, like, yeah, it is. I mean, like, in a health condition, it doesn't seem good, but at some point, it makes you like a great person with different accent. Yeah, I think that.
Genius.
Yeah, a genius. Like, can you imagine, like, you're talking like a normal person but with different accent? Yeah, that seems cool.
Okay, I will share my opinion. For me, the most weirdo thing is allergic to water because we can't live without water. For example, how she takes shower or so. Yeah, this is the story which I like the most.
Okay, for me, I think the most weird story is the person who the body grows like the wood. No, it's like me to remember the movie The Avenger. You know, one superhero. The name is Groot. You know, it look like the Groot in our life. So I think that's very weird. And for those kind of person, I think they are very painful for this. So for me, I think this is the most the weird story.
I agree with Chen Yiheng. So I like the second story.
I think the second story has like a lot of interesting things to talk about because, like, as you mentioned, it's like a person's turning to wood. It's like the reverse of Pinocchio. Pinocchio is someone who's made from wood turned into a human. This is like the complete opposite. So I feel like that's really interesting. And I don't know. I feel like in all of the stories, that's the one that's probably the craziest. Like, okay, you can probably like imagine like someone being allergic to water, sure, that could be a real thing. Someone like talking in a different accent, yeah, that works. Even someone who has like a different like bone density, right? But like this is someone who's turning into wood. Like, man, that is magic. If I have not seen this before, I would imagine there were like this person must be cursed or something before I heard about this health condition. So I would say the second story.
So I think most we all agree on the second story for our documentary. Is everyone okay with that?
Yeah, sure.
Yes. Okay.
Yeah.
All right. So with that, I think that's the end of our video discussion for today. Thank you so much. And I think for next week, we will do it at the same time. And then for next week, which pair will present?
Our group will present.
All right. So we set everything. So I think that's all. So thank you for your time today, and good night, everyone.
Thank you, everyone.
Thank you,
Good night.
everyone.
Bye.
Good night.
Bye bye.
Night.